You will know because you're all here for one reason, and that's a notification from me that you're here for a webinar with a couple of world-class experts on the subject of microcurrent therapy. In a sense, the three of us that you can see here, that's John, Lorraine, and myself, we met and bonded because of this particular subject. We didn't call it that in those days, but I brought out a book called Virtual Medicine and had the foresight to put in a chapter about the scanner device, the Russian scanner. And I said, you know, this is the future. This is where it's going. And I was proved ever so true. Anyway, the scanner took off, became hugely popular. Then there's lots of Me Too devices. And now there's a whole rash of them, as we'll be seeing. But it's developed into a discipline, a specialty, best called microcurrent therapy. And it's along biological lines. It's using fairly low frequencies and very low power outputs. So it's not like mains electricity or the kind of thing that's driving your computer and so on. Very, very low voltages and current. But biologically speaking, bodies and cells and organisms are very sensitive to that kind of signal. Okay, so with that said, let's make a start. Just a few minutes late, and those of you that come from now, I'm sorry, but we had to make a start with or without you. So let's introduce my speakers for those who don't know. These are the experts. I'm just the guy that's putting this together. First of all, John, come on, introduce yourself. John, these are pretty impressive qualifications. As I said, we met with the scanner, didn't we, way back when, seems.
Yes, we did. My gosh, I believe it was in 1999 when I first made my way to England. Invited by Laurie, who today is my wife. And
good trip.
Yeah, that was a great trip. One of the first books she actually put into my hands when I got in the car was Virtual Medicine by Scott-Mumby. I was so impressed. I said, I don't know how we're going to do this, but I have to meet this fellow someday. So, and we have met. We've met several times.
Indeed. I stayed at your house, a beautiful place up in Vancouver Island. Gorgeous up there, yeah.
Yeah, gorgeous. And here we are. It's been 16 years.
Right. Tell us about some of these impressive qualifications, John. You don't need to give us them all, I guess, but, why are you probably the number one trainer and teacher of microcurrent therapy, well, you and Lorraine together, in the world?
I think, just like everything else, things start almost by accident. You run into people. I remember Dr. Irina kind of banging on my door along with her husband way back in 1998, 1999, and they wanted to introduce me to this device that they call the scanner, and I had no idea. I had no idea what a scanner was, and they weren't even ready to show me what it did. I had 3 clinics running, and as you know, when we are in this field, we're forever looking for ways of being able to help people out of pain. And I was a naturopath, herbalist, homeopath. I'm also board certified in biofeedback, and of course now, and also in Chinese medicine, and now in the field of microcurrent. I haven't been in pain for 16 years. I've been working in the field of pain for 16 years.
Oh, that would sound good. Yeah, I've been in pain for 16 years. I get your point, yeah. Eminently, yeah, and of course you've raised a point that I think is very important about tonight's webinar, particularly for practitioners. This is a wonderful extra to your bottom line, your skills and abilities. It's something that any practitioner has to get into these days. Okay, let's meet the lovely lady now. Let me just have the stage for a minute, Lorraine, because I want to say this. Everyone knows the story now about you and the scanner on the streets of England and the guy that had an axe buried in his head. I wrote it as one of the invitation emails, so you're kind of a celebrity on that score alone. But anyway, tell us about yourself, buddy.
Well, as you can see, I got most of my qualifications in the UK before sort of meeting with John and then moving forward in different technologies, all the homeopathy, traditional Chinese medicine, reflexology, all of those, but then finally coming to microcurrent in 1998, which is the field that I love the most, and that's really where it is today and how comfortable I am with this.
That's great. Now remember to share your thoughts with us as we go too. Don't let John hug the microphone. Anyway, let's move on. So what I want to say, electroceuticals is a term that you may come across. It means using electricity for, for medicinal purposes like pharmaceuticals or nutraceuticals. I've got to say that what we're introducing tonight really is a massive, an enormous paradigm shift that started now in medicine. And it's here. We are part of it. We're actually the cutting edge, the leading edge of this. Basically, the old days of flooding all parts of your body with toxic and uncontrolled and not very well understood chemical substances, drugs, it's over. It's history. It doesn't make any sense when we can much more accurately target things. Electricity, all right, if somebody gives you too big a jolt, electricity can be dangerous. But in the low-level forms that we're talking about, it's basically natural to life. Life is built on electrical phenomena. The difference between a corpse and a living person is that the living person has electrical activity in their body. The cell has a natural potential difference at the surface. That in other words, it's an electrical potential. That this is what defines life. So in fact, it's very natural. But the great thing is it allows us to control things really tightly, really accurately targeted, and of course very programmable. We can tell it to do all kinds of sophisticated things. If you just pop a pill, it goes everywhere till your kidneys and your liver throw it out. It's absolutely everywhere in your body. But you can program electricity. Well, think of smartphones and computers, how precisely and tightly these things can be programmed, and you'll understand why it's interesting and exciting. Now, I put this in, folks, because I want you to really understand as part of tonight's webinar that it really has arrived. It's in Scientific American. It's one of the best-known prestigious scientific journal. It's not a backwater journal by any means. If it's in Scientific American, it's at least accepted as scientific. And they're now writing, as you can see, this was earlier in 2015, March 2015, what they're calling electric cures. And if you can't, I don't know if it's big enough for you to read, but it's saying bioelectric medicine could create an off switch for arthritis, diabetes, even cancer. This was quite a lengthy article. In fact, it was basically saying there's the promise of this kind of treatment to use for all sorts of diseases and may become an alternative to pharmaceuticals. They particularly featured what you can do with vagus nerve stimulation, which John's going to tell us about in a moment. But, as I said, in this prestigious magazine, it says, look, we know this stuff works. It's proven to work for things like rheumatoid arthritis, asthma, obesity, inflammatory bowel disease. You can do it directly to the brain and head, not via the vagus nerve, and treat things like Alzheimer's, Parkinson's, hypertension, diabetes again, and all sorts of other areas, other nerve systems. Specifically, they mention these diseases, hepatitis, cancer, irritable bladder, and more. So it really, really has arrived. It is not alternative, it's holistic, of course, but it's not particularly alternative medicine anymore. The smart orthodoxy is actually jumping on this, and in fact, as you'll hear John tell us shortly, even the massive pharmaceutical companies, GlaxoSmithKline, have put millions of dollars into this. Talk to us a little bit about this vagus nerve experimental approach, John, would you? Just, we don't want to do too much anatomy here, but I want folks to see that the vagus nerve is very big, very complex, and goes to many, many, many parts of the body. So why is it an advantage to stimulate that?
Well, when they realized that the brain had the capacity of being able to control inflammation throughout the body, they set out right away to try to find a way to hack the nervous system. And they said, well, the brain itself is so complex, how are we going to do this? Until somebody came up with the fact, they said, well, why don't we hack the nervous system via the vagus nerve? It is the wandering nerve. It goes and visits just about every organ and system in the body. So if we could hack into that, we could possibly control inflammation. Because it's the vagus nerve, actually, what it does is that, of course, we all know about fight or flight, which is that stress response to danger, and the parasympathetic mode, which is that mode which is eat, sleep, digest, assimilate. And the vagus nerve is responsible for getting us out of that fight or flight and into that parasympathetic or eat, sleep, digest, assimilate mode. So what they were finding is that by stimulating the vagus nerve, they were able to control inflammation throughout the body. And they did their first tests on rats. And what they did with the rats is they would slit their neck open and they put a jelly bean-sized little stimulator, or electronic stimulator, clamped right onto the vagus nerve in the neck. And then they sewed it back up and they let the rat move around for a day, relax, make believe that he was out of trouble. And then they injected the rat with a tumor or a necrotic factor, which is an inflammatory substance that would, you want to see if they were able to stimulate or simulate inflammation anywhere in the body. And of course, with this vagus nerve stimulator, the rats were not responding to inflammatory stimulus. So they said, well, my goodness, why don't we try this on human beings? So they recruited people that were suffering from severe inflammation. Rheumatoid arthritis was the people that they recruited. And they realized that after a short period of time, these people were actually rheumatoid arthritis pain-free. So from there, they started to extrapolate, and they said, well, my gosh, we were able to control inflammation throughout the body, even the splenic nerve and all of these other areas, without having to use drugs, which are harmful, and they flood the whole body. And here we're able to target specific areas and get the brain to use its own onboard pharmacy of anti-inflammatory drugs, if you will, what we call cytokines. So the body is able to do this on its own. Now, when I first got involved with this SCENAR many years ago, this was the premise. They were telling us that using this technology, harnessing the brain in the healing process is what they decided to do. This was a program that was supposed to help people out in space. They were going to be launched on this Mir space platform. They would be out there for a year and beyond, and they needed something to help them out. And of course, we all know that if you get damaged in space, you have to wait till you get back down to Earth to get fixed. And so they were looking for a device to help these cosmonauts out. And so they did come out. It took them a dozen years to figure out how to do this, but they knew that by harnessing the brain that they would be able to have better healing control.
Yeah. John, can I step in? Let's come back towards the vagus nerve, because I don't think we've quite finished on that. Just so that people are clear, it's very calming, isn't it? Calming and soothing, and it slows the pulse, it relaxes the person, and as you said, reduces inflammation. Now, the way we stimulate the vagus nerve isn't quite as dramatic as opening the neck and sticking in a small electric pod. But how do we do it with these devices, you know, the kind of devices that folks are here to listen to?
Well, the way we do it is we place an electrode directly on the vagus nerve itself.
On the skin outside, yeah, on the skin over it.
On the skin over it, so we don't have to open it up. We can do it right on the vagus nerve. And by using an alpha waveform that we find in these professional devices, the post-board 3 that we'll talk about, we were able to harness that particular signal and stimulate the vagus right through the skin itself.
Yeah, so pain-free, inflammation-free, you know, it works, yeah? Okay, let's move on, because I want you to tell us about some cases. You know, you've had some awesome cases over the years, haven't you? Laurie, would you like to talk us through this one, perhaps?
This was a guy, this actually was done in Russia. And he got electric arc burns, 20% of the body, and he was brought in to see if there was anything that the SCENAR could do to help bring down the inflammation. We worked directly on him, so it was actually the electrode of the device directly on, which you can see by just from the dates how fast this treatment was.
About 2 weeks, yeah?
Yeah.
Just about 2 weeks. And to a
And
virtually
also on his
recovered
hand.
face, yeah.
Yeah, and if you have a look at the last one on the 7th of November, you can see that he doesn't really have any scarring. His face, there's no inflammation, there's no swelling, there's no redness, and it was as quick as that, and his hands also. So normally a person would end up with some sort of disfiguration. There is nothing. He needed no plastic surgery.
Yes.
He was just...
Amazing. And he got full use of his hands. You see, they get scarring on the hands and it pulls in the fingers, but obviously that didn't happen to this guy.
No, we got to him quick enough. He was brought in 2 days after he was injured, so we got to him quick enough.
Right, lucky him. Yeah, great. Oh, now, John, tell us about, I guess I know you, this story I thought was really impressive. The guy that got frostbite, I mean, it means amputations, period. So tell us the story. I'll just stroll slowly through the slides while you're talking.
This fellow is, he was not far away from us. We live next to an Air Force base, which is the search and rescue squadron for the Northwest for Canada. They travel all the way up to the Arctic Circle, I suppose. And what happened is this young fellow, he's about 21 years old. He was trying out to become a search and rescue technician. And they sent him up to northern Alberta, where they have some pretty difficult evaluations that they put them through, and he had his feet frozen, so they flew him out of there. I think it was on about he got his feet frozen on a Wednesday, and they brought him into me on a Friday. This was his sergeant brought him into me on the Friday, and so I sent to work immediately.
Didn't you say you were scheduled for an amputation on the Monday, or seeing the surgeons or something on the Monday? So you had like 3 days to produce a result, yeah?
Yeah, the sergeant was also part of the medical group. So he said, "Listen, the surgeon has an appointment with him on a Monday, and it doesn't look good. I do believe that they're going to have to amputate some toes. And 21 years old, it's not a good idea." So I'd worked with this fellow for in years before, and he said, "I know that you can help him out. You've got the equipment. So let's see how he does over the weekend and see if we can save some toes."
Mm.
So I immediately was able to get the inflammation down and start the regeneration, increasing blood flow, perfusion.
This is something that particular device can do, isn't it, John? It's got an algorithm setting that will create extra blood flow and, with the extra healing potential, yeah?
It's all automatic, and the first thing we want to do was we wanted to arrest inflammation as much as possible, and immediately increase blood flow and angiogenesis, creating new blood vessels and perfusion throughout the tissue.
Yeah.
And here you can see on treatment day 10, I actually called him up. I was worried. I said, "You've disappeared over the last 5 days," and I said, "Where did you go?" And he said, "I went to see my girlfriend on the mainland." And I said, "Well, I bet you're not treating yourself while you're away." I said, "Would you drop into the office?" And he said, I'll jog over.
In 10 days.
And the base is about 3 or 4 miles away. So he jogged 3 or 4 miles over, and he gave me a bottle of wine. So he had a bottle of wine in a backpack.
Oh, well, he was happy. I mean, wouldn't you be? 10 days, and as all trace of frostbite has disappeared. It looks like he could do with some pedicure, but that's another story. Yeah? and the heels recovered as well. All right, do you want to tell us about this one, Laurie?
No, this one's John's.
Oh, okay, go ahead. Yeah, sorry. All right.
Well, you can see by the date, the chronic problem with ulceration and gangrenous ulceration started in the year 2000. And the only solution they were offering her was amputation. So in I think it was 2012, mid-September, June 2012, she dropped in to see one of our people from Montana. Her name is Ruby Tennant. And Ruby set to work immediately, and by the end of June 2012, had pretty good control. And by mid-September 2012, that whole leg had pretty well healed.
Yeah.
Now, she was only doing 20 minutes, several sessions a week, because that person was far away. Now you have to know that Ruby lives in a place called Webo, Montana, which is, I don't know what the population is.
It's not very many, and it's so far from any civilization at all.
But they've got one of these microcurrent therapists there, yeah?
She is so good, is Ruby, yes.
That's great. Okay, now, yes, we were talking about this. I just wanted to make this point. So in amongst the treatment, the direct treatment with a device, you can actually couple it with PEMF as well. And I think a lot of people listening, I'm sure, would know, the value of pulsed electromagnetic therapy. So you can get that connected to these, you don't have to buy a big expensive device, right? This is just a small add-on attachment to one of the small handhelds.
This will attach to any of the devices. So, it doesn't matter which one you buy, you can also get it one of these.
Yeah. Right. Now, here's another case that's similar, but it's not the same case, is it? So tell us about this one.
Oh, this oozing wound, it's crazy. One of the reasons why I'm in naturopathic medicine is because I hated blood, gore, oozing stuff, and people's pain was just something that I decided that I turned away from traditional medicine and went into naturopathic, and I fell into this pit.
Yeah, you're a bit like me when I eat steak. I'm supposed to be an MD, but I always say I want it pink, but no blood. I can't stand the sight of blood when I eat it.
So this one, she used to spend, oh my gosh, the price of a rent in a good quality apartment just to clean up the oozing and the terrible wounds that she had.
She went everywhere, didn't she?
She went everywhere. This was since 1986 until she ran into Ruby back in May of 2012. And Ruby set to work immediately, and we can see from May to August. Of course, by mid-June, she no longer had to spend all that money on cleaning up material. And by August, she was pretty well out of the woods.
Right. This reminds me of one of my early cases. I think I told you when I was living in Spain, this guy knocked at the door. He'd got the wrong apartment. When he heard, as they do, when you're at a party, it's, oh, you're a doctor. Oh, I've got this pain. What do you think it could be?
Of course, yeah.
So it was exactly like that. It was a total stranger at the door. When he heard he said, he can't do anything for this, can you? Whipped his trouser leg up, and he had a huge trophic ulcer like this. And I said, well, as a matter of fact, I can. And I treated it on day one. He came back on day two, and it was already closed. And I treated it again, not over the wound, but round. But by the third day, I could put it directly on the wound. And by the 5 days later, he was, skin was regrowing, he was real happy. So I can back that up too. These things are miraculously fast. And what's orthodoxy got? Nothing, just more lint and gauze, more bandages. And of course, the bandages themselves cause, trouble with blood supply and nutrition anyway. So this is a great kind of thing. Oh, yes, tell us about this guy. Come on. He looks in trouble. He's had an argument with the pavement, yeah?
Yeah. He had an argument with a car. And he was on his bicycle. He was in Oregon, and he was rear-ended by a car, and he was left for dead on the side of the road. Somebody picked him up, brought him to emergency. And when he woke up, he said, my God, I don't have insurance. Take me home. And I have a device at home. And when he did get home, he gave me a call. And he said, John, he said, now is the time. I have one of these home devices. He says, now's the time to put it to the test. I got my wife to take a picture of me with a newspaper. He says, look at this, it's the 1st of July. And I looked at the newspaper on the picture, and I said, you've also got blood stains on you.
I only just noticed he's dropped blood on the front of the newspaper.
Yeah, exactly.
My goodness, that's terrible. And then what, 8 days later, the 8th of the month.
He was completely restored. He only had a little bit of a little blood break in his eye. He didn't know how to treat that because he was treating himself, and he had this hole in his cheek that had closed up pretty well. And he said, how am I doing? I said, how is the pain? He said, you know what? He said, immediately once I started going to work on myself, he says the pain disappeared. And he says it was all cosmetic from there on.
Yeah, great. Wonderful story. And then this girl with facial paralysis, tell us about it. Yeah. Laurie, can you do one? I mean, John's got a lovely voice, but you've got a prettier one. So.
This lady, she had a tumour behind the eye. And then when they decided that they needed to do surgery, they accidentally cut the trigeminal nerve. So she lost control of the muscles on the left side of the face.
Yeah, hence it
So
drops.
she,
Yeah.
yeah, so she was brought in to see another one of our practitioners.
From New York,
Yeah, Helga Evans.
from New York State.
Yes, and Helga did 4 treatments, and they were very basic treatments because Helga was only recently had learnt how to use the device, so she was a little bit wary about using all the different parameters within it. So she said, I'm just going to do the basics. She did. 4 treatments later, the lady regained full control of her
Right.
face.
And to me, this has always been totally impressive. You know, I mean, when I bought my first one, I didn't hardly know how to switch it on, never mind do the settings, and yet you get a result. If you just switch it on and blunder around, something will happen.
Yeah, if you get any dynamics at all and you get the body moving, then you'll find that it will improve.
Yeah, yeah, nature again. Oh, yeah, wound healing. Now, that's a whole big topic in itself, of course, isn't it? Tell us about this.
Yes, it is. I'll just drop a little a little quote here. I'll actually be in Kuala Lumpur. I'm leaving this weekend, and I'll be attending the International Wound Healing Conference in Biotherapy in Kuala Lumpur. That's slated for, I believe, it's next week. And I think I'm the only representative from North America attending this international meeting.
Yeah, what an honor. It's great.
So they have realized that microcurrent is the way to go, and they just need. I spoke to Dr. Harry from Kuala Lumpur when I was there about a month ago, and he said, I need somebody to come and talk to my people about microcurrent and how we can accelerate wound healing and how we can make it better, faster. He said, would you come and speak? Of course I'm going to come and speak.
Yeah, of course. I mean, this is one of it, preventing scarring and rapid healing. This is one of its extremely powerful capabilities that patients are gonna love you for. Yeah. What about this lady?
Yeah.
This lady was nursing staff herself. Yeah.
Oh, this one was sent to us by a chiropractor from South Carolina. And it's fun to receive all of these pictures before and after shots from therapists that are just starting all excited about the speed of recovery of their patients. And this chiropractor says, this was so quick. He said, now what I'm doing with my chiropractic, he said, I'm doing everybody's scars, and I called everybody to come in. He says, it's up my practice by so much. He says, you won't believe it.
Right. Yeah, there's a tip for those of you listening who are practitioners, right? All sorts of mileage about this. Oh, no, this looks hideous. So tell us the story here.
This is from another practitioner, believe it or not, from Missouri.
Yeah.
And what's her? Diane.
Diane,
yes. Diane has sent this in, and this was a bit of a shocker for her and her practice. What happened is, you can see here, tissue removed for a skin graft, and you can see the appearance before the first treatment.
Yeah. And
the
then
mesh is visible.
Oh yeah, still yeah. And then after, this is only the next day. Look.
This is the next day after the first 30-minute treatment only. The tissue is already beginning to cover the mesh.
That skin coming in over the mesh, yes.
Epithelial cells multiplying very quickly and covering that whole wound area.
Wow. And then
this is part of what I'll be presenting in Kuala Lumpur.
Right. And this is 2 days. It's almost gone.
Yeah. On day 2.
Mm-hmm. It's amazing. And just short sessions, yeah, like 20, 30 minutes. You don't need to do an hour or 2 hours of treatments to get this result.
No. And once the body receives the message, it goes ahead and activates that part of the healing process very, very quickly.
Yeah, gosh. And we got a before and after. Yeah, there we are. So you can see the range in just 4 days from that to that. Yeah, wow. Yikes. Okay, now let's talk about pain management. That's come up. You mentioned it a couple of times, but this is a biggie, isn't it? Pain is probably the number one reason people ever go and see the doctor or any other practitioner. And we could do rather good with that, microcurrent therapy. Talk us through it, John. Let's see what yeah, here you go. I mean, here's some background slide for you to work around. Yeah, tell us about pain relief.
Well, I think that pain has been a problem forever. What we used to do with pain only up until the last century has been quite extraordinary. You just had to deal with it.
Mhm.
Pain is involved in all inflammatory processes. We have when inflammation comes in, you're going to have swelling, redness, heat, and pain, and a lack of or loss of range of motion. And it was actually described by a fellow from Italy, probably sitting in an arena somewhere after these fights between lions and Christians. In 0015 AD, that's over 2,000 years ago.
Yeah.
They were able to describe inflammation, and it's only lately that we decided that we can actually do something about it without having to have recourse to all of these medications and other products. So,
Yeah. Can I just say something for a minute, John? Because here we've got narcotics here, opioids, they're sometimes called opium or morphine-like compounds. This is coming out in my newsletter the coming Friday, but the over-prescribing of those things here in the US is so bad that they reckon 30%, that's almost 1 in 3 people sitting opposite you in the office or in the coffee bar at Starbucks, 1 in 3 people are into some kind of narcotic dependence or, abuse, or, it's just such a common phenomenon. All doctors think of doing is prescribing these damn things, and then people can't get off them. So they become invalids due to their dependency on these terrible drugs, and they're prescribed still like sweeties, big problem. Anyway, sorry to interrupt, but go on, carry on.
yes, well, they've decided, narcotic drugs. One of the problems with it is that, depending on the state you're in, you definitely can't drive your car. It's almost like we'll put you on this medication, but we're going to take your driver's license away,
Yeah.
and you're going to have to depend on your friends and family to drive you to work. Oh, by the way, work. Well, I don't think that you should be operating heavy equipment. And I don't know how well you're going to be doing with small bits that you're going to have to manipulate either.
Yeah,
And
it's
the
terrible.
problem is that you're going to go through different levels of anxiety and anguish, and you may not sleep as well as you'd like to.
So we better give you sleeping pills and some antidepressants, because you're going to be depressed about the ruination of your life. We're laughing. What can you do? It's not no laughing matter, of course.
Doesn't sound that good, does it?
No, not really. The thing is, it won't do a darn thing for you because you're still going to have pain.
And if you don't take the drug every 4 hours, it's back again. There's no cure. I mean, it's ridiculous. Anyway, come on, talk us through this. Let's move on. All sorts of kinds of pain issues that we can deal with. Fibromyalgia is a biggie. I mean, do you know I didn't know this till I read this article from Medscape, that a large number of opioid prescriptions are actually fibromyalgia. There's no scientific rationale. It doesn't do any good. The person who's already in trouble is now dependent on morphine-like substances. It's crazy. But we can deal with that rather easily, yeah?
Yeah, well, fibromyalgia has been found to be brain-related as well. And what we described a little bit earlier on about vagus nerve stimulation will actually get the brain involved in its own healing process. And this is what these devices do so well. I mean, it's almost odd that nobody had ever thought of including the brain in the healing process up until now.
Well, all pain's in the brain in a sense, isn't it? Yes, the sensors are out in the skin and the body, but it's the brain that, puts it all together and said, ouch, isn't it? So why not?
You can have a brain, you won't have pain.
They have this long argument about whether pain is central or peripheral, but the brain organizes it, so it's all central. It's crazy.
Absolutely.
Now, you were telling me years past about all our US NFL football teams having a scanner, or this kind of machine anyway, for injuries to athletes and so on. Why? Because it works. You get them back on the pitch quick.
Absolutely, yeah.
Costs money.
Football players and hockey players as well. We have a young fellow that Perone that actually is a hockey player. I think he was with the New Jersey. I think it was New Jersey. One of these hockey teams, and had a traumatic brain injury, because a lot of football players and a lot of hockey players do have that problem. And we actually, one of our distributors helped him through. He actually treated the neck and shoulders and the head, and he was back on the ice in no time. Actually, he tripled his contract value. He went from $3 million to $17 million contract.
Wow. I hope you got a cut on that.
I never did.
That would have been good.
A lot of kids need to carry these sort of things in their bags. I mean,
Right.
a lot of children, they just have minor injuries, but then they carry on and become chronic injuries, and they're trying really hard to prove themselves and to get a career as an athlete, whether it's soccer, whether it's basketball or whatever. But we find when parents get these sort of devices and give them to the kids, they are so capable of using them, and their injuries last a couple of days and then they're gone, and it's just the best thing to have one.
Right. And I mean, you were talking about traumatic brain injury just a minute ago, John. I wonder if it'll solve an axe in the skull. It'll solve most traumatic brain injuries, I guess. What about
Dramatic that.
now? One of the first, my very first encounter with the scanner, as it was then. We got other devices we're going to mention, but as it was then, was back in 1999. I met the Russians, Ravenko and that crowd. And the first demo they ever did, the first thing I ever saw, was a frozen shoulder. This woman could not lift her arm above the 90-degree mark. 15 minutes of the scanner, she could lift it high over her head and wave. Frozen shoulders are biggie. It's very common, and it's very nasty if you've got it, isn't it?
It is nasty because you lose all. First of all, I had a lady that I worked on in Texas. We were doing some filming. We did some video stuff, and she came in and she couldn't move her arm away from her side. And she'd been so active. She was engaged in the gym, and she was exercising at least an hour and a half every day, and she was fit. And then this thing happened, and she could no longer go to the gym. She was in constant pain, couldn't wash her own hair. She was, my gosh, she was fit to be tied. And she was going on and on and on. And she said, I don't know if you can do anything for me. I'm giving up. And I'm treating her at the same time. And I said, would you raise your arm over your head, please? And she's still talking, and her arm is up in the air. She says, oh, my God.
Yeah,
I don't believe this. How did you do that?
Right, and that's minutes, not a week or 2 weeks of treatment. That's minutes of treatment, isn't it? It's amazing. Tell us about, it's kind of the philosophy of pain, how we approach things. How do you approach? Let's start with acute pain,
Well, acute pain, of course, pain comes in different flavors. You're going to have acute, where something has just happened. You just banged your. I'll tell you, I did something stupid a while ago.
Of course.
I closed the garage door, and they hadn't connected the electric door. Don't laugh, it's fun. They hadn't connected the door closer, so I put my fingers in the garage door and I pulled it down.
Uh-huh.
But I was smart enough to put my foot under the door before I cut all my fingers off. But I'd squeeze my fingers in the garage door.
Ow! Yeah.
Ow!
But the thing is, Keith, he couldn't do anything about it. So it wasn't until I said, where's John? And then I actually found him stuck in that position.
Stuck to the garage door. I don't know why I'm laughing, John. That's cruel. But anyway, I know the rest of the story. It must be that you got healed pretty quick. Tell us.
Well, what happened is I went in, and it had squeezed so badly that the 3 fingers were split and bleeding.
Yeah, they were.
Listen, I've got pain in my hand just listening to the story. Keep going.
So I went into the house, and of course I yelled for Lori. What else could I do? And she looked at me and she said, "Oh dear," the way British people say it, "Oh dear." So she put my hand under the sink, poured some cold water on it, just to see how to get the blood out, to see how much damage was there. Then she grabbed the device and she put it on my fingers, and immediately the pain started to reduce. Mm. And where you squeeze your hand, it's so sore. You're squeezing your fingers, and you want to squeeze them off. It's so bad. Yeah. And then I just went away. Mm-hmm. Amazing. And I was on my way. I was in a hurry. I was on my way to Seattle, Washington, where I was going to attend a biofeedback conference. And so I had to get down to the ferry dock with my car, and I put 3 Band-Aids on it quickly, and I drove off to the ferry dock, to the terminal, waiting for the ferry to come to bring me a car across to Port Angeles. And Lori says, she calls me up. She says,
I called him up. I said, "How's your fingers?" He says, "My fingers? What?"
He'd forgotten.
He'd forgotten.
Now that's what I call acute pain.
Yeah. Right, yeah. That's what I call a cure for acute pain. All right, talk to us a bit more about Well, I suppose this could be acute pain, but I think we moved on to chronic pain in a way. Tell us these, how we approach chronic body painful conditions like backache, knees, arthritis, bad necks, and stuff.
Well, the problem with acute pain, if you don't get to it in a hurry, and if you don't treat it properly, like Lori did with my fingers, it can become chronic. And what happens is that the body will actually build a wall around it, and it will wall off that area of damage to try to keep it away from the brain, I suppose. And it's probably walled off with dead cells and so on and so forth. And it can now this chronic pain, which is called what we call a low-level inflammation, can go on for days and months, years, decades. This pain can be there, and what happens is it leaks downstream. Nothing is ever dead in your body; it's always ongoing, and you find just like ashes from a fireplace. I mean, these ashes will leak down into your bloodstream, and wherever tissue they land in, we give the name of a disease. So you can see that just about every disease starts off as some form of inflammation. Mm-hmm. So we're starting to think that there's no more disease names, there's only inflammation.
Yeah.
So these devices will help find that low-level inflammation. You can have dozens of them going on at the same time.
In different parts of the body,
they'll help find the area, and not only that, but they'll deliver anti-inflammatory treatment right across that barricade where nothing else can get in.
Yeah.
Blood curtails around it.
All right, let's have a look here. So, like for example, here, there's lots of pain sites. What is this point of pain, and how does this chart apply?
A point of pain is anything that the client or the patient can point to with one finger.
Yeah. Even if they got several other places, they could say, this spot is the worst in my body, yeah?
This is the worst. If they can point to the worst spot, then we go to what we call the point of pain rule.
Mm. And you treat that, yeah?
And we'll treat that in an anti-inflammatory program which is an algorithm that has been set up within the device.
Yeah, okay. Now, I mean, I should say it's not already obvious and clear, but you teach this kind of technique. You show people how to apply these rules and how to get the maximum advantage, don't you, from using.
I've been teaching this for 16 years. We have a great time doing it. Why do we have a great time teaching about pain? Is because the great time comes when we see everybody's pain resolved.
Right. Well, I remember that we went to a conference one day. It was Harveka, wasn't it? You announced that you'd treat anybody's pain. It looked like 7/8 of the room had pain. There was a queue right around the hall in no time flat to get some treatment. I remember that. That was great. All right. So there are other ways of approaching pain, isn't there? Tell us about the dermatomes or the neurological segments.
It's another part of what we teach, is that the dermatomes actually connect from the spine onwards towards the center of the body, what we call the median. So if we can find the area of concentration of the pain, we can actually trace it around to the exact spot that is being affected by it, or where it's coming from. If it's an expressed pain that comes from an organ or a system, we can even find that.
Yeah. So, I mean, a pain on the hand could actually be being fed by a segment from the neck bone, nerve outlets at the neck. Yeah. So it's clever to know these things, isn't it? Because you might find the pain is in the fingers, but the problem is up in the cervical vertebrae area somewhere.
It could be in the brachial plexus, where the nerves come out of the spine and head down the arm, where you have the tree nerves that come down the arm.
Yeah.
And it could be a pinched nerve. You could have carpal tunnel, but it could be caused by a pinched nerve near the C7, below C7.
Yeah, so it's smart to know these. You have to know what's what. All right, now let's talk about these relationships, the mirroring. I have an example of this from my own life. My son is a chef. He skidded on a greasy floor in the kitchen and smashed right through his ankle joint. I mean, it was a very complex and disastrous fracture. When I got to see him, he was covered in pot way above the knee, so I couldn't treat the injury. I just treated the opposite side. Still got a miraculous recovery within a matter of a few weeks instead of 4 or 5 months, as it might well have been. Explain the rule to us, John.
Well, we're connected somehow left to right and diagonally, and we can see that in young children as they cross crawl. A child that can't cross crawl, left hand, right hand, just
Hmm.
like a marching soldier.
Yeah.
Um, when they can't do that, there's something wrong with them neurologically. So it's whether we're connected. Let's say the right leg is connected to the left leg via the sacrum, or the right arm is connected to the left arm via the cervical spine. We find that we can access the opposite side by treating. If you have a pain in the right hand, we can easily treat the left hand, especially if you have it in a cast. And we'll see that we do that often with animals or people that are stuck with a cast on an arm.
Yeah. Yeah. Okay. And there's other rules like this, like diagonals and things. So keep
Yeah,
talking.
the left and right shoulder is an example of that mirror relationship where you have pain on the right shoulder. And this is a chiropractic principle as well. We should go now when if you have pain on the right shoulder, you're not going to be using that right shoulder very much. You're going to be hyper using the left arm instead of the right.
Hmm.
So what we do is we'll go to the opposite side and treat that, and then watch the pain go down on the right side, bring it down to the maximum amount that is left, and then we'll go back to the right side and finish that off,
Yeah.
so
Okay.
that we handle. And also we'll look at the pain that comes around the spine area. These devices permit us to be able to take readings, which are galvanic skin response readings, giving us a good idea of where the highest stress on the body is.
Yeah. So it could be diagonally opposite as well, upper and lower as well as right and left, like this.
This is one of the things that I discovered is that when somebody, for example, has any kind of damage, it could be a hockey player, somebody's run into the boards, or any accident that you have, or an incident where you may have some muscle groups that have been damaged slightly, probably microscopically. You'll notice that the brain tells those muscle groups to not be used and sometimes forgets it on the back burner. And when you put somebody face down on the massage table, what I do is I measure the leg length by the two knobbies on the ankles, and I bring them together. And if they are off, sometimes they'll be off by an inch and a half. Then I look down the body and I'll find a high shoulder and a low shoulder. And I'll find the opposite diagonal side, you'll also have a low and a high hip. Usually if you have a high shoulder, you'll have low hip diagonally.
Hmm.
And by treating the high shoulder with the device, you'll find that automatically the legs are realigned, the hips are realigned, the shoulders and the neck are realigned. And then you can go back to shopping and spending lots of money in the shopping center,
Right.
walking malls.
Okay, so these are skills, of course, that we have to learn. Oh, yeah, now tell us just a little bit about this. I don't want it to be too complicated, but you can have acupuncture meridians and points marked on different parts of the body. I know the ear, that's Nogier's system, isn't it? And on the face. Tell us about this.
The nosier points are all of the body points you can find on the ear. And this was weird. There was the Russians came out with a device called an AccuVision, and
Mm,
the AccuVision permitted us through a corona effect and via what we call dialectic to be able to see with our eyes acupuncture points.
yeah.
Nozier was not Chinese; he was a Frenchman,
Mm,
and he had mapped out all of the points on the ear that represent all the organs and systems. So of course the Chinese said, "Well, we don't know about that." So with the AccuVision, we put a dialectic on the ear, and we're able to find that these nosier points were exactly where this Frenchman said they were.
right. Now, let me just explain something, John. You use this word dialectic. It's a scientific term. For most people, it's just simple. You lay a sheet of polythene over the area, don't you? And then you see blue light streaming out where the acupuncture holes are, if you do it right.
Exactly.
As you
Like
say
white
there.
lights.
Yeah.
You see white lights, almost like star, or if you ever flew over a city at night, and you
Yeah.
see all of the lights down below, you'll see all of these acupuncture points light up like lights over a city flying over at night.
It's totally amazing, isn't it? All right, now these other zones then, okay, like well, explain what the color zones that we see there. How does that help, John?
It helps us to be able to organize the body by segment. So anything that has to do with the head, we would treat the neck, the shoulders, and the head. And this comes in useful. I remember a young hockey player who was a star hockey player with the Canadian team who put in the last goal or the winning goal during the Olympics against the Americans. I think they remember that. And he had been banged up into the boards and he had a traumatic brain injury. And he tried to come back a year later and still was not able to play. And it was only then that they found that the cervical spine had been damaged.
Mm.
Now, by treating this way, we automatically would have treated the cervical spine and the head and the shoulders. So anything that has to do with C7 on up.
No, don't be technical. Those are cervical vertebrae bones, but don't be too technical on us.
I'm sorry.
Now, in fact, I tell you what, Don, let me remind you, because the other day we were talking about, let's say, the green band. That would be great for prostate enlargement, wouldn't it?
That'd be great for prostate. Anything that has to do
Or
with
uterus,
the leg,
yeah.
Yes.
and the pelvic zone, we would treat around that green band.
What about dysmenorrhea, Laurie? Is that good for period pains and troubles using the green zone?
Definitely.
Yeah.
Yes.
Well,
we would treat the whole of the green band.
You have to tell them the story about that lady that you once treated that sat on your expensive chair.
Oh, yes. Yes, in my clinic in England, and she'd been having serious problems, no periods for a long, long while, no menses. And then she was sitting, I had this very expensive antique chair, which was not one normally used for patients to sit on, but for some reason she was sitting on it, and I treated her with the device. The next thing I know, she
Blood
stands
everywhere.
up,
Oh.
blood all over my chair. Yes.
Oh, no, I can see that coming. Oh, my God. All right. Let's close the door on that. There's a lot of men listening too. You know, I think, you know, I have a jokey saying, a lot of men suffer from premenstrual tension. Did you know that? Think about it.
I've been through that.
That's what I mean. We suffer too. Anyway, let's look at a few devices. So the scanner, you know, made this famous back in the 90s. I came up with this phrase, Star Trek medicine. This is like, you know, Bones has one of these things in his hand. Click a knob and the guy will grow a new arm. We haven't quite reached that level yet. But anyway, that was the metaphor for the original scanner. The written one was the most famous and best made of those, wasn't it? This is our favourite at the moment, yes, the Avacia Sport, because this has got all those fancy programs in, like blood supply and, well, you were telling a couple of things you were saying, John, just before.
Yeah, this one is.
Anti-inflammatory.
I love this device. I've written all of the manuals on the Skinner devices, on all of the other devices that are around. I've also written the manuals on this one, but this one I love the most because it has all of the programs that I've always wanted in the machine. For example, I have all of the alpha, beta, delta, theta, gamma, you know, all of
come to that. We'll come to that. We will come to it. I'm not putting you off, John. We'll come to it. Let's just have a run through. You know, I just want to give people the flavour of what's out there. This is another kind of scanner, isn't it? The ENART. And quite a popular one is this one, you know, the DNAS. A lot of people get the DNAS. I understand it's multi-level marketed, but apparently we're having a bit of trouble with Russians at the moment. It's not so easy to deal with them, is it? Would you explain that?
There's a bit of a geopolitical thing going on. I don't know if it's because of this fellow Putin or somebody else, but definitely we're kind of squeezing the true economic sanctions, what goes on economically between USSR and the USA and Canada and many countries in Europe, so that parts and service to these devices has become almost non-existent.
Yeah.
So of course, having the Avacia for us is a godsend because we have a turnaround service 48 hours, and we're able to have a local company that manufactures this. They're all old AT&T, not AT&T, but Texas Instrument people.
And they're in Texas, so they're nearby. Yeah. Okay. Let's. So I mean, there's dozens of those. So I'm not just going to put up lots and lots and lots of pictures of scanners and similar devices. Tell us about neutralizing scar tissue. And though I know that's. I mean, there's a sort of citation there. We've also got a picture to go with this. Talk us through this, John.
Well, scars have been found to be able to build resistance or impedance all the way up to 1.5 volts. Now, that's a lot of voltage against the rest of the body, and they've been finding that scars actually are impedance to healing. And I think lately they've found that organ transplant rejects, kidney, for example, may be related to the scar tissue and not to the reject of the organ itself.
Wow, I didn't know that.
So,
yeah.
So what we found, I started including scar tissue treatment, oh my gosh, 15 years ago, following some research that had been done by another fellow in the States, a fellow by the name of Klinghardt. And what I started doing immediately, I asked one of my Russian friends, I said, what frequency can I use to be able to neutralize the electrical buildup on these scars? We've been using a product called Procaine, where we would take a small acupuncture needle and like sewing back and forth over the scar with this Procaine. But we found that Procaine stays in this body for so long.
Yeah.
So we found that by setting the device up on a frequency of 77 hertz, and we're able to neutralize rapidly the electrical buildup on the scar and get rid of its impedance. And then, of course, the other thing about scars is that it has a certain emotional value. The brain remembers the trauma of the creation of that scar.
Mm-hmm.
So again, we're involving the brain in reducing or releasing that emotion. And of course, the last thing is also the aesthetic value of the scar. We're finding that by treating the scar, you can see here in the picture, this is only 3 minutes. This fellow was able to tell me, he said he was actually doing a video for us, and I was looking for somebody with a scar, and he said, I have a scar. So we let the marketing person run the camera, and he came and sat down. And I said, how did you get this one? And he said, oh my goodness. He said, I fell with my bike. I went over a tea kettle over the handlebars, and the pedal came up and scraped along my back. He said, and I haven't had any feeling there ever since.
Ouch. Yeah.
So only after 3 minutes of treatment, he felt warmth come back to all of that part of his body. And we all know that when you lose feeling in tissue, it's just a question of time before it becomes chronic and it can develop a problem.
Yeah, amazing. All right, let's talk about inflammation. That's probably the last big topic. I mean, it's the biggest of all topics, as we were saying. It's behind everything, isn't it? From arthritis to Alzheimer's, cancer, diabetes, and many more. Inflammation is a big story. Talk us through it, Tom.
Well, the oxidation happens to just about everything, from your windshield wipers to your car itself to a bite out of an apple. And even the aging process itself is related to some oxidation that's going on. We use oxygen to be able to transform our food into ATP, adenosine triphosphate, which is our cells' energy. It's atomic energy that our cells use to be able to wiggle and jiggle and excrete and secrete and do all the things that a cell does. But at the same time, it causes secondary effects that we call free radicals or free radical damage, is when these electrons are left behind. So oxidation and inflammation is connected to it. So we're seeing free radicals as part of the inflammatory process.
Right.
And the speed with which the body is able and capable of being able to neutralize these free radicals will tell us how long that acute inflammation is going to hang around.
Right. Yeah. Okay. Why it's in some ways it's good, isn't it? But we don't want it around for long. Why would we need inflammation?
Well, inflammation is a process where reactive oxygen species or little white blood cells come into the area of invasion. Let's say if you have a splinter in your skin and then you're going to have bacteria that would be attached to that bit of wood that just pierced your skin. So your body sends in these white blood cells carrying oxygen, singlets, if you will, on their back, and they use oxygen to be able to degrade the molecular structure which these invaders represent. If you can break up the bonds of the molecular structure, then you're actually deactivating, if you will, the process.
You're risking getting a bit technical for some of the listeners, but let's just say you need the immune response, don't you? Which is partly removing debris and toxins, partly neutralizing possible pathogens and so on, and then clean up afterwards. That's what it's all about, isn't it?
That's what it's all about.
As you say, a splinter, you'd end up with a swollen red finger for a week, but at the end of a week it would all go away. But what happens if it doesn't go away, John?
Then it becomes what we call chronic inflammation, and what I describe as chronic low-level inflammation is the precursor to all of these 4,000 diseases.
Yeah. So we need to be able to deal with inflammation. Oh, yeah. We're back to a kind of list in a way. I mean, this list could go on and on. If you start with autoimmune diseases, there's about 120, well, probably way over 200 by now. It goes up all the time, doesn't it? But there's a lot of things associated, like heart disease, for example. I used to think it was all about cholesterol and blood fats and clogging the arteries and all that nonsense. We now understand it's inflammation of the wall lining the arteries is actually what does the root damage and so on. So it's a big inflammation's a big subject, but we can deal with that. Explain. This is one of the devices here.
There's we have these new devices like this ProSport 3 that I love to use. It has a program in it that you just have to hit the down arrow and you go down up to a program called Modulate. And Modulate seems to be able to reduce that inflammation, the swelling, the redness, the pain almost immediately within. If you come in with a pain 6, 7, 8 out of 10, we're able to bring that to below 2 and almost down to 0 and within 5 minutes maybe, which is faster than any medication out there.
Right. Well, I mean, medication is mostly about suppressing the nerves, isn't it? It's so-called analgesics. This just shows the power of reducing inflammation, because that's where the pain really comes from. And if you can reduce that in minutes, it's brilliant.
What I say is that if you can reduce the redness, the swelling, the heat, and the pain, and have an increase in range of motion, you knock all the flags down, and you have a real anti-inflammatory program going.
Yeah, a good one. All right, let's talk about structural stuff, musculoskeletal stuff. For example, sciatica is, that's a common problem. Well, it's a catch-all word in a way, isn't it? Any kind of back pain that goes down your leg. Oh, it's sciatica, says the doctor. Here's your pills and, 3 weeks off work, sick note. What should happen? We have a better answer, surely.
Yeah, one of the first things that I always look at is a body alignment, structural alignment. If you have one hip out, you're going to be putting a lot of tension on the nerve on that side of the body, and of course you're going to be facing inflammation of that nerve in that part of the body. So the first thing we do is we work on the structural realignment, and then we'll go in and work on the lower back area to be able to quench that inflammation and down the leg to the area of greater pain, which follows, strangely enough, the bladder meridian all the way down to the Achilles tendon.
Mm-hmm.
So we're able to do what is necessary, not only get rid of the pain, but align the structures so that we get that pressure off that nerve.
Right. Now, talking about aligning, let's have a look at scoliosis. This is just a posh Latin or Greek. That's Greek, isn't it? For a bendy spine, you can see some examples of it there, folks. That's what we mean by scoliosis. You wouldn't see the bones, of course, they're being added, but you'd see people with those strange postures. And a good chiropractor or osteopath would recognize scoliosis. You could deal with that, yeah? Tell us about scoliosis.
Definitely. I think one of the most dramatic for me cases of scoliosis that I did was in Lubbock, Texas, a couple of months ago. I was working at the community health center in Lubbock that, by the way, have adopted microcurrent for all of their clinics. And one of the first things that they were looking at was to be able to circumvent the use of narcotic drugs, like we mentioned earlier on.
Yeah.
Now we're looking at it as to be able to intervene in pretty well all acute and chronic pain situations. And one of the things that we were looking at, whenever I see somebody's back and I see scoliosis, and there were scars all over this person's back where they'd gone in and they'd actually used little rods like you would a tutor on a tomato plant to try to keep the back straight.
Mm-hmm.
So the first thing we did was neutralize the scars. This first rule, neutralize scars. And the second, we went in and we aligned the. I work on the high side of the scoliosis in a certain frequency, and on the low side to build up the tissue. And right in front of my eyes, we could see the spine come right back into its normal position.
I think I've got a. Is that the lady?
That was another case. This is
okay.
We do a lot of it.
All right. Well, I'll tell you what. Let me go back then we don't skip. Tell us about this. This is a young girl, isn't it, with X-rays?
Laurie, yeah, I'll let Laurie tell this one. She was involved in this one for sure.
So this was a young girl that was brought into a clinic down in Florida, and she had this scoliosis, and her parents were really concerned because she was going to end up having to have a rod in her back and everything. So we did one treatment, and then we sent her home and said we'll see her in a few days' time. When she came back for the second treatment, because you've got to remember, when you treat, this keeps working. So for the next 24 to 48 hours, the treatment is still continuing. So that goes for reducing pain and inflammation as well as altering bone structure, etc. So when she came back a few days later, we had over-treated her to the point that the spine was slightly the other way. So another very quick 2-minute treatment, and she was straight. And she wanted to become a gymnast, and that's what she went on and became.
Yeah, amazing story.
Yeah, you can see the position on the zipper exactly on the X-ray.
Yeah. Oh, yeah. I mean, yeah, and you can see the one on the left. Well, in fact, no, it's more this lady. You can see her pelvis is rotated to the left, isn't it? Just looking at her belt or the belt loop, you can see it's off to the left there, and how that comes back towards the
spine as well.
Yeah.
Right. So, amazing that just a few minutes you can do that. All right, listen, I've slipped this in. You can actually treat animals too. This is a lady with a fancy device on her arm, but she's using an electron, metallic glove to pass the microcurrent to the horse, yeah?
Yes.
And I think you're telling me...
She has a conductive pad on the horse, which is the ground, and the active electrode will become the glove, which is totally electrified.
Yeah, you were telling me, Laurie, how they like this, and well, of course you've done a lot of animals, but we've got our favourite story, and maybe we should do him now, Alexis and his broken leg.
Yes, this is one of my...
Where are we? Where's his... there's his fractures. Oh my God! I mean, look at that on the top photographs. There, it's a shattered leg, isn't it? Tell us the story.
Yes. Well, Alexis jumped off of the sofa onto a slippery wooden floor and broke his leg. We were away, and so one of our kids took the dog to the vet, who said that the leg needed to be amputated. Well, the kid says, no, I can take the dog home and my parents will work on it. But, then they wanted $5,000 to deal with the dog. And so it was like the kids were on the phone to us saying, what do we do? And I just said, bring the dog home, we'll drive home. And we were like, oh, it was going to take us a good day and a half to get home. But the kids, they wouldn't let them leave with the dog. So they agreed to have a cast put on the legs. So as soon as we did get home the next day, we started working on the opposite leg. We kept having to go back to have the dog re-x-rayed just to see that everything was going okay. And because he kept chewing his cast off, and so it's like we knew, the vet was looking at us and thinking, you are strange people, don't know what you're doing. But in the end, the leg healed so fast, so quickly, that then they decided that perhaps they'd made a mistake in the x-rays.
Oh yeah, it wasn't really a broken leg. Look at that at the top right. It's shattered.
Yes, I know.
But this is the final get out of orthodox doctors. They see a miracle cure, but it couldn't have been a miracle cure, so we must have got the diagnosis wrong. I mean, that's their mentality, isn't it? It's strange. Anyway, cats and dogs, they love it, don't they? I mean, they just go for this. It's so simple for them.
They just, like, if you've treated them once, when you come back the next time, they're looking for the device in your pocket. It's like, They're just so excited to have a treatment again.
And Catty's too. And here's one, you're doing it with a comb kind of
Yes.
attachment, yes, so that you get through all that fur.
Yeah.
Yeah, amazing.
See the excitement on the cat's face.
All right, well, let me just coming towards the end now, folks, just talk to practitioners for a moment. I'm going to come back to ordinary folks, so don't go away. But, this is such a great addition to anyone's practice, really. It's a simple, easy to use type approach and produces these easy, kind of amazing, well, they're miracles, aren't they, that we've just been seeing, really. There's no other healing modality that will work that fast. It's going to add something significant to your bottom line. People want this. They clamour for it. When word gets around, you guys don't advertise, do you? I mean, word gets around everywhere. Sooner or later, cases find their way to you. Is that right?
Yeah, we don't need to advertise. It's just word of mouth, and it's so fast.
Right. And with all of these devices, they all have little extra things. I've come up with this phrase, a hospital in a case. You've got your little healing device, and you've got your little combs that add on in your probes. There's a little one that John will tell you about in a minute, but that's great for stimulating the vagus. The startup cost for these things is pathetically small, really, in this sort of range, 3.5 to 4.5, which for a major new healing modality that you can put in your practice is really negligible, and it's easy to learn. Listen, this technology is set to explode. Everybody's going to be doing it. Those who are in first are going to be the masters and the teachers and the people that the others will look up to. But you've seen already, orthodoxy has suddenly woken up to the fact that this happens. Now, this is our favorite device at the moment. I've got one of these. I had the Scana for years. I've written about it, made it famous. I'm known for it, but yet I made the switch, and I'm glad I did. Talk us through what this beast, I mean, it's a kind of electronic beast, isn't it? What does it do, John?
Well, the most important thing is if we follow it down, we say, okay, we have an automatic frequency in there that will handle scar tissue. And the next one that we have is our programs that actually are anti-inflammatory programs. So once we get the scar tissue handled and we have the inflammation down, now we're ready to go in and help tissue heal. So we have programs such as Vaso, which increases blood flow, like the ones that you saw in the gangrenous injury that the fellow,
the frostbite one,
where we saved his toes. Yeah. And angiogenesis is the process where we have an increase in the blood vessels.
Right. Now, you wouldn't use that near a cancer, would you, for that reason? You don't want blood supply for the cancer, so you work elsewhere if you've got a cancerous patient, yes?
This is where the reflex zones become interesting.
Mm-hmm. Tell us.
On the hands, the feet, and the ears, but away from a tumor that's cancerous.
Yeah.
And we also have we now know that the brain, I think my mother told me this a long time ago. She said, John, you see, your body is run by your brain. What's wrong with you? And today we're starting to realize that all of these disease states are actually controlled by your brain. So we have the alpha, beta, delta, theta, delta, and gamma programs.
These are let me just say, John, you mean brainwave frequencies, like alpha brainwave frequency. Theta is sort of trance and dreaming and almost hypnotic relaxation state, isn't it? Delta is sleep and so on. So frequencies these mean.
That's right. Yeah, the chakra programs. A lot of things I've seen fibromyalgia patients respond extremely well to the chakra programs that are in this device.
Do you put the device on the chakra center, or does it matter? It could be anywhere.
You put it on the You can choose in the device from the root chakra right up to the crown, and then you can also run a step program that takes you automatically through all of the chakras. If you have a problem, for example, where you could never do enough. You always have to scurry around all day long because somehow in your life you were not able to get acceptance of some kind. Mm-hmm. You find a lot of people will end up with digestive problems, all kinds of digestive upset. And of course, if when the vagus nerve is put aside and you go into fight or flight, then your digestive system is put on the back burner.
Right. Now, what's this about? Sorry, I didn't mean to interrupt, John. Well, I tell you what, let's keep moving now, because people, may have to start leaving after about 90 minutes. Facials, you can, perhaps Laurie should answer that, but you can do cosmetic treatments, can't you? Tighten up, do your tucks, but without any physical intervention, just using these devices, yeah?
Yeah, they're called not the non-invasive facelifts is what I call them. Yes, you can build collagen, build up the fatty tissue, smooth out wrinkles. You can do so much, and it's all within the one device. So you don't even have to have a special device for the face.
I think we should do a cosmetic webinar perhaps in the near future.
Yeah,
That's a
yes,
topic in
definitely.
itself. It's great. Yeah. Okay. Now with this, oh, hang on. I've lost my control over my slides from. Oh, there we go. So that comes as a kit. I've said this is the health professional's choice, the hospital in the case bit. Everything's there, isn't it? They've got probes and combs and different ways of administering the doses and so on. If you're interested, let me say this first, because I talked John and Laurie into being willing to give some free training for anyone that wants to buy one of these devices as a result of tonight's webinar. They'll throw you in at least 1 hour training session. It won't cost you anything. You just have to buy yourself a device, and you need some help. You can't put a price on that, but you could argue easily that that's $1,000 or more of professional time. Certainly, if you flew into California to Los Angeles or somewhere to one of their treatments, you're looking at travel and hotel and so on. So to be able to do it online as a webinar is going to be great. So remember, you can get some training. You don't just buy one of these and have to figure it out for yourself. You're not on your own. You've got two of the world's leading masters here that can help you with that. Anyway, to take a look at the cost and buy one of these, there's another device I'm going to talk about in a minute for the home device. But you go to my website, alternative-doctor.com/MCT webinar. That's microcurrent therapy, of course. MCT webinar. Okay. Now tell us about this device. I mean, this is a kind of home device. You remember years ago I came up with this saying, every home. Well, I didn't come up with a saying, but I coined this idea of every home should have one. It was based on the title of a movie. And it meant an au pair girl. Every home should have one. I think it was Britt Eklund. Anyway, we thought that would do really well for a scanner. Every home should have one. And really, why not? You've seen the miracle healings that these things can do. A professional person would need what we've just looked at. If you're serious about wanting to charge customers consultation time and make it a professional living, or add it to your professional living, that's what you need. There's no question. But look, for ordinary folks, what about this one? Tell us about this.
Well, everybody, whether you live on the East Coast or the West Coast, whether you're dealing with hurricanes or land, or tremors coming out of the ground, we don't know. Or if you're living in the Central America, then you worry about tornadoes. And being the first to the emergency room is out of the question. When by the time you get there, you might be you might be number 500 as you're sitting there trembling, and I won't go into detail. So what we did is we came up with we got Avasia to manufacture this one for us, and we call it the Avasia Life because this is your life device. It has all of the frequencies in it, from earthing frequencies, the 783, which covers different frequencies up the scale for everything from muscle to blood flow to nerves, nervous system, and so on and so forth. So it'll handle the whole thing. And so if you're thinking of running around barefoot outside or hugging a tree, that's good as well, but this will do the same thing indoors if you're worried about freezing your feet off.
Yeah, and quicker. Now, for example, there's a setting for inflammation, isn't there?
We also have all of the inflammatory frequencies or anti-inflammatory frequencies. We also have scar tissue at 77 hertz. We also have at 60 hertz, we have what we call dosing, which means the device will tell you when the brain has been contacted. It'll tell you when the brain has accepted treatment. So then you can go ahead and put it on a program like Blue Stimulate, for example, which is used for the acceleration of wound healing.
Yeah. Amazing. So a simple to use device, not as sophisticated as the professional one, but the price reflects that as well, doesn't it? And you can, if you want, you can add in you don't have to get the kit for this one, but you can add in the kit if you want. It's there as an option. And again, so if you want to make a purchase following up what we've talked about, why not? If you're a professional person, I think it's a given, really. Alternative-doctor.com MCT webinar, MCT microcurrent therapy. Hey, listen, there's even one for pets, isn't there, for dogs? We don't sell these, but they're available. So the thing to do is talk to your veterinarian. If you can talk them into it, send us an email. We'll tell you where you can get the best Vet Pro and the best vet. These are great for animals too. We think they're fun. They're lovely. Okay, I'm going to look at questions in a minute. Oh, just before I do, let me just tell you about John and Lorraine's books, a couple of books. Well, in fact, tell me about the current medicine, John, and you tell me about cellular makeover, Lorraine.
Well, the current medicine book is a book that we put together to be able to cover pretty well everything from acne to zoning out, A to Z, and with full pictorials. It's a guide. It's got all of the illustrations that guide you along on the areas that you should be treating for any physical problem.
So it's like a protocol manual?
Yeah, that would be good. And of course, as I was saying, there's 3 hours of training with you, the top experts as well. What about the cellular makeover? What does that do?
Well, that was really intended for people to use these devices so that they can do the non-invasive facelifts. It just really leads you through how you work on the face, how you work on cellulite, how you work on tummy tucks, etc., through microcurrent.
Right, and these really work. They really do help with wrinkles.
Mm-hmm.
I think I'm going to join one of your classes then, and now I'm 70. I'm going to have to learn how to use it on myself. Although I'm told I'm fairly online. Anyway, that's the end of our formal presentation, folks. And I'm going to take questions now. Don't worry, we'll be here a good while yet. But if you have to go, we do understand. If you want to get one of these, we can only take so many on the free instruction classes. So, if you made a decision, get over there and sort that out now. On my website, as I said. In fact, let me back up, so I'll leave you with that, so that if you missed it, you can refer to it while we're talking. Oops, done the wrong thing suddenly. From the start, but I don't want to go from the start, do I? Let's go right back to the end. Hey, oh no. I was just trying to leave the website visible for everybody. Look what I've got myself into now. Nah, dear. I did go through a lot of stuff then. Here somewhere. Shortly after the pets, wasn't it?
Yes.
Oh, no. There we go. No? There we go. All right, so with that in place, for anybody who can't remember, I didn't write it down. Let me see what I can make of the questions. I've got to tell you, this is my first time with this instruction panel, so I'm not even sure how to do it. I think if we double click on it, it will reveal itself. Okay, first question from a chap called Olaf. Any suggestion on a method to get rid of cataracts without a laser operation?
Yes, we have a document that I put together. A lot of the problems that we have with our eyes are related to blood flow and to the electrical potential of the eyes themselves. And I think you wrote an excellent article, Keith, on that a while back.
Yep.
So what we do have, what we call goggles that we are able to, that actually fit on the eyes or over the eyes, and and you just follow the programs that I've laid out, so that you can use this device to be able to help with that.
Yeah. Okay. And of course that's pretty targeted, isn't it? Yeah. Would you use the vaso setting, say, for something like that, or?
Well, yeah, if you want to increase blood flow, the vaso setting is perfect.
Yeah, okay. Oh, some of these are just hellos from old friends looking to connect and so on. These are not necessarily questions. Someone said sound's gone. Gosh, I hope that wasn't true. So I'm not sure if this is a question, but a person called Peter Canaris. Vagus nerve, 10th cranial nerve, stimulation for tinnitus. Have you heard that one, John? Tinnitus is big news, I wrote about assisted suicide about 6 months ago, and there's a terrible case of a woman, youngish woman, in her 40s, in Holland, where they'd assisted her to commit suicide because she had intolerable tinnitus. That's terrible. I mean, when medical professionals are so ignorant, they can't deal with something like tinnitus. They've got no right to help a person take their life. It was dreadful. I mean, food allergy often helps, for example. And now here we're learning that maybe, microcurrent therapy could help tinnitus. Any comment on that one? As I say, it's not quite a question, actually, but what can you say for us?
Yeah, well, definitely one of the things that medical doctors do with tinnitus is they actually refer them to acupuncture.
Yeah,
And in acupuncture, what you're doing is you're using needles to stimulate specific points. And what we're also finding is that acupuncturists are using microcurrent to stimulate these points, and they're getting a lot better results.
yeah. Okay,
So
so, sorry. I'm sorry, John, I didn't mean to interrupt. Are you done?
the yeah, so the other areas, because it's such a complex problem, in Chinese medicine we connect the adrenals, the kidneys, called the kidney meridians, to the ears. So the adrenals play a huge role, and people that are very high strung and have a lot of stress will have a lot of tinnitus.
Yeah,
And the other thing that we're finding is neck and shoulders and stiffness. The neck and shoulders will reduce blood flow to the ears.
right. I mean, it's so amazingly treatable. I was just stunned. I felt sick when I heard that, assisting somebody's suicide. You can understand them, a woman in her ignorance and desperation wanting to do something, but for doctors to step in and help, yuck. Okay, let's move on. Someone here, Gene, he's in Berwick. Where's the NS in Canada?
Nova Scotia.
Oh, Nova
No,
Scotia, of course it is, yeah. Yeah, Gene Keys. He's come across a company, a UK startup called Reminova, that claims to be able to use MCT to remineralize teeth. Have you heard that one?
well, we're doing a lot of work with it's not so much teeth, but what we are getting back from dentists, Dr. John Bond from Fort Worth, and a whole group of dentists that he works with, and also I've started working with dentists in Lubbock, Texas. What we're finding is remineralization of the jaw,
Oh, yeah, the whole jaw, yeah.
the
Okay.
whole jaw. So yeah, so the teeth are an expression of the jaw.
Right, yeah, good point. Okay, moving on. Susan Armstrong. Oh, the poor girl. Well, she'll probably want to give you a call. We'll connect you later if she wants to see you. Severe nerve damage in her leg, ankle, and toes due to rare and undiagnosed, then misdiagnosed sciatic nerve entrapment in the hip. Whoa, well, I hope she was still with us at that point in the talk. She'd have been excited. She's got foot drop as a result. That
Yeah.
means the nerves to her foot musculature have been so damaged that her muscle tone is lost and her foot will fall on the floor and probably trip her up from time to time if she's not careful. Electromyograms are pretty terrible, she said, and some with no response at all. This has got to be a yes, hasn't it, John? Come on. What
Yeah,
would you say?
definitely. I treated foot drop in Kuala Lumpur last time I was. No, it wasn't Kuala Lumpur. It was in Chennai, India. And one of the things, if you look at the before and after picture that we showed you of that lady whose trigeminal nerve had been cut accidentally through surgery, and we see that her smile has come back after 4 treatments, is because somehow the nerve has regrown.
Yeah, the body knows what to do if you just give it a helping hand, doesn't it? Yeah, so that's a yes. So that lady should have this kind of treatment. Either get her own device and learn to use it, or find somebody who's got one, or just call you guys anyway. All right, next
Mhm.
one. Steve Proud. Oh, I'm not quite sure I understand his question. Will this device work on its own? No, you've got to switch it on, Steve. And you've got to push it around. I'm not quite sure. That's all he says. Will this device work on its own? So
It
I
can
can't.
work on its own, yes, Steve. Sorry, Steve. It will work on its own. You can use conductive pads.
You think that's what he means? Okay, all right. That's a good point then. All right. What about any? So if somebody wants any information here, probably himself. Information on internal healing after surgery, inguinal hernia, for instance.
Yeah,
Man is called Richard. It's got to be abroad, yes, as well. I mean, we covered that, didn't we?
Yes,
Cashless,
absolutely.
totally.
post-operative healing. It's one of the best things that we do. Does the MCT also heal the physiological problems that cause these pains? I think we said that too. Do you want to add anything? Oh, this is
Yeah,
Hank Levin. I've just realized who asked this question. My friend Hank Levin in the Bay Area. Yeah, so The answer is it does, doesn't it? You know,
Yes, it does. If we talked a little bit about inflammation, for example, which is a precursor to a lot of these, or even 4,000 diseases. If we can get back in and we can quench or put out this inflammation, and then we have to go in and correct the damage that has been caused downstream from the inflammatory side.
yeah, and of course, changing and increasing blood flow, that's bound to have physiological knock-ons too.
And lymphatics and so on and so forth. Yeah.
Right. Okay. Here's a lass called Carol McFarlane. She's got an older, well, an ENAT. I think she's missed the T off, but it's an ENAT, small version of the scanner. These models sound better, are they? Oh, yes. Wow. Explain just quickly for her. She will probably wants to get one of these newer devices. Why it's really a good investment, John. I mean, it's just a different league to the old scanners, isn't it? They had one or two algorithms, and these new devices have got scores of them. Well, dozens of
Yeah,
them.
they have
Anyway.
scores. Well, I think that science and technology doubles, but every 2 years or maybe more.
That's what they say.
We have a son that's in engineering physics, and by the time he finished university, he was saying that all of my books, the first 2 years, are already outdated. We're having to train on things that have not even happened yet.
Yeah, scary. But yes, I mean, wonderfully much better, isn't it? The scanner in its day was amazing, miraculous, but it just hasn't had enough investment and moved on enough, whereas the American-made version has got all the bells and whistles that we know of at this time. Am I right about that?
Yeah, I think they've kicked it out. They kicked the ball right out of the park.
Yeah, oh, that's an American expression meaning what? Very good. Is it?
Yeah.
Could this work for autoimmune diseases? Oh, yes, yes, and yes again. Come on, one of you. Autoimmune diseases are all about inflammation. There is no quicker or more powerful solution to inflammation, is there, than what we're just talking about? I mean,
Yes.
goodbye your omega-3s and your curcumin and turmeric and things. Just get one of these. You're down to minutes instead of days or weeks, right? As we've seen.
Yeah, there's a story very, very quickly for multiple sclerosis, for example, which is considered an autoimmune disease, and you may have, Crohn's disease, you have many others, lupus, and we did lupus not so long ago, I think 2 weeks, last week in Lubbock again, and what they found is that a woman who has multiple sclerosis who becomes pregnant, all of her symptoms disappear during the pregnancy. So somehow the body has a capacity of being able to interfere with these autoimmune diseases. And the same thing with Crohn's and the same thing with irritable bowel syndrome. Any of these autoimmune diseases all disappear during pregnancy. Does it mean that you have to stay pregnant? But it means that the body has the capability of being able to auto-repair itself.
Right, yeah, exactly. Okay, here's a good point. It's not exactly a question. It's from a man called Benedict who made contact with me about a week ago. Nice man, and he's obviously clearly involved and passionate about microcurrent therapy. He wants me to say this. Over the last 100 or so DNAS orders from Russia, they've not had any issues with delivery. So, some of it's working. I think our issue, though, wasn't getting them, was it? It was if they had to be repaired, it's sending them home to Russia and getting them back again in the end. That was the tricky part.
Yeah. Well, greetings to Benedict. I know that he's had great success with the Avasi devices.
You know each other. Okay, that's great. So we're all pals. Prostatitis. Oh yes. That's Hank Levin again. Come on, Hank. Well, I'll finish all the other questions before I give you a third, but this is your second go. What about prostatitis and the inflammation of the prostate, and also benign prostatic hypertrophy? Talk about that.
Yeah, BPH is 100%. The devices have 100% success rate with benign prostatic hypertrophy. There's no doubt about it. I mean, I've treated my own, and I'm totally free of that.
What do you do? You sit on it with the pad up your bum?
Yeah, you can sit on it.
I won't go there. Now, there's ladies listening, but anyway. No, you can treat it front and back as well, can't you? You don't have to go deep down below to actually.
Go in and increase the blood flow in those areas.
Yeah. Okay. And prostatitis, of course, slightly different. Inflammation of, you can get that with sexually transmitted diseases.
Still inflammation. Yes.
Yeah, exactly. So good for that one, Hank. Oh, Carol again. What about have a bone-on-bone osteo in the knee? Would it help or regrow cartilage? It's a good question, that, and that's a tough question. What do you think?
Well, there's the first thing that we want to do is we want to permit the synovial fluid to return to that area. And one of the things that keeps synovial fluid from coming into the area or migrating there is inflammation. So we need to get the inflammation down, number one. And then we need to be able to encourage or nudge the synovial fluid back in. Synovial fluid acts as the cushion between the bones. And there are certain things nutritionally that we can do. Hyaluronic acid as well, and type 2 collagen, and all of these things are available now. But the first thing you want to do is definitely get rid of that inflammation.
And this is the way to do it, yeah. And I should say this is just general. It's nothing about microcurrent therapy, but you can see the most ghastly X-rays of bones wrecked and joints hypertrophied and atrophied, and yet a month later the patient can be pain-free, and 6 months later the X-ray's all good. The doctor's view that once the X-ray shows damage, you're done. It's just not true, is it?
No.
No, your body is very dynamic. Somebody once said that you can't. It's like a river. You can never put your foot in the same place twice. Your body is so dynamic. Everything changes constantly. 1 second from now, I'll not be the same person as I was.
Right.
1 second.
And I think they say 9 months from now, you won't have a single molecule that's the same. I've forgotten the figures, but you know the story anyway. All right, Lily Partha. It's Partha or Partha, madam. But have you used this machine for autism? No, not me. And if so, what were the results? Have you guys?
Yeah, we have. We actually have a family member who's gone through that, and he's actually in what? How many? He's at university.
Mm-hmm.
He was totally autistic, dyslexic, and he's gone forward tremendously. Where now, the greatest thing that I've seen with autism is at the beginning, poor mom had to put her hands behind her back to be able to even give him a hug, and now he embraces her full arms around his mummy.
That's great. Can I just ask you quickly for how or where you treated that? What kind of algorithm and what parts of the body? Did you use head all over?
Head, shoulders, and head. When we showed the body how it's divided into 4 different zones, you definitely want to do neck, shoulders, and head. And we did introduce a homeopathic remedy called lycopodium.
Oh yeah.
It is the only, and because of his dyslexia. And within days, he was able to read where he wasn't able to read before.
Okay, well, that's a good start for you, Lily. Maybe you should get one of these devices, learn to use it, and do a roll your own miracle at home. That could be good. Will it raise testosterone and HDH? This is Dan Hannaford.
Yeah, we have a setting on the device for HGH.
Oh, I saw that. Yeah, on the list of algorithms that you've got. Yeah. Okay.
Testosterone, I won't go into the details on where you put it, but definitely it will.
Yeah, okay, all right, good. What was the device used on the horse? Says Lorinda from Australia, I should think. Don't recognize your surname, Lorinda. I don't remember, darling. But anyway, if it's Lorinda from Australia, whatever. What was the, that funny electronic glove that was being used on the horse's face? Can you tell us again?
I think that's totally brilliant. So, somebody's using their head. And we have now gloves that are totally conductive.
Yeah, so all it was just literally a glove, a conductive glove, and a conductive pad. So you got the ground and the glove attached to any of the devices.
The pad goes on the horse, and the glove goes on your hand, and wherever you pass the glove.
Yeah. Right, now, so you don't need any combing necessarily in the glove, you just stroke.
No, you just stroke, or just hold your hand still.
Right, okay, Peyronie's, it says Peyronie's syndrome. I presume it means the penis deformity. David, somebody called David T.
Scarring of the penile tissue, yeah.
Yeah, I was going to say scarring. So, yeah, have you had a result with that one, or has someone amongst your army of acolytes had a result that way?
It's actually one of the only solutions.
Yeah, okay, good one. All right, gosh, there's a lot of questions. I have an Avassia Life. How much different are the Pro and the sport. So the Avancia Life, if she was to move up to the pro sport, what extra would she be getting? I would say if you're a professional, do it, Lisa, but listen to why. Yeah.
There's so many more algorithms, isn't there? So many more programs.
Yeah, there are 53 algorithms in the, I'll give you an example. There are 53 algorithms or programs. An algorithm is a program on a chip that actually runs by itself. So what you do is you put it onto an algorithm and let the device do the work. There are 53 algorithms in the professional unit. In the Avancia Life, there are 2 algorithms plus the dosing. So you've only got 3 algorithms really in the Avancia Life.
Yeah.
But it's still 2 algorithms more than in the Skinner.
Yeah, so I would get the bigger one and sell your Avancia Life. I'll keep that for camping trips and things. Okay, Elizabeth, how does this differ from electrical frequency device like the GB 4000 Rife device? Well, I don't want to do Rife. You can give them a quick answer if you want to, Elizabeth.
Yeah, quick answer is Rife devices are what I call electronic antibiotics.
That's the quick answer. Okay, next. Type 1 diabetes, Barbara Holly's asking. She has a 10-year-old granddaughter with type 1.
One of the big things that came out of Toronto Hospital was the fact they were able to take rats or mice, I don't know which one it was, one of that species, and they were able to inject the pancreas with an anti-inflammatory, only to find that the rat that had been engineered to not secrete any insulin all of a sudden started secreting insulin like crazy.
Wow.
So, pancreatitis, even type 1, is an inflammatory process.
Yeah, you've got to hand it to nature. God, you can do anything. All right, Lee Richardson, does the home version have a frequency that works for neuropathy? And she's specifically mentioned 77 hertz, 60 hertz.
Yeah, Vaso works extremely well because what we're looking to do in neuropathy is increase blood flow. In the Avancia Life, I would have to use something like the 780, the 783, the harmonics, which takes you through several frequency programs.
Right. Okay, so yes, broadly. Nice big thank you from Barbara. Which precautions should be... Oh, this is a good question. I want you to be careful with this. It's being recorded, remember. So, which precautions should be used in a cancer patient? You know, what should you not do? We mentioned briefly, don't go near the tumor, for example. Just run us through that. It's an important question that will come up again, I'm sure.
Yeah, tumors are a big deal. So what we do is what we're looking at is anti-angiogenesis, which means that we definitely want to stay away from creating blood flow to a tumor. So usually in cancer, for the mass, the automatic is don't go anywhere near a cancer victim with this device. But for those of you who are professionals, we also know that what goes with cancer is definitely stress and dropping of pH. So what you want to do is you want to get that, and cortisol secretion, which goes through the roof. So what you really need to do is get them out of that stress zone. And we're starting to understand now that the vagus nerve is responsible for the inflammatory response, so that when you're stressed, you are creating inflammatory cytokines like crazy and cortisol like crazy. So get them into a quiet zone.
Right, now, so back to that vagus nerve thing. In fact, the professional kit that goes with the Sport Pro has a special Y-shaped wand, doesn't it? That's just perfect for stimulating the vagus.
Absolutely.
Yeah, so that would be the one to get. Okay, Wolfgang from New Zealand. Hello, Wolfgang. What settings are best to be used to stimulate the microbiome? So if you're talking about ABS cases, Crohn's disease and so on, what settings would you use?
Well, let's see now. Again, we have to go back to any inflammation that's in that area. You would want to use a program like Modulate. And then you want to increase lymph and blood flow. So you could use Vaso. That'd be one of the better ways to do it. And then you want to keep it going by using the 783 harmonics, which takes you through all of the programs.
And would you look at things like, large bowel meridian, things like that? Are those valid approaches to add into that?
Well, when you're dealing with crowns, again, anything that has to do with the digestive tract, we would definitely want to use the vagus nerve, what we call little wing stimulation. Interestingly enough, they did a double-blind study in South Korea where they used the device right at the base of the neck, which is right on the vagus nerve, and they found that by using galvanic skin response and heart rate variability as a redundant, that they were able to bring people right back down into parasympathetic. And if you want to protect the body at all, that's where you want to do it.
Yeah, big time.
That zone.
All right, good answer for Wolfgang. Now listen, I'm worried about the time. We've got about 12 or 13 minutes. I'm not even halfway through the questions. We'll just keep going. But let me say this, if I don't get to your question by the end, please email the question again. I'll make sure it gets to John and Laurie. They're very kind and decent people. We'll do it for you, even after the webinar. They will answer. And of course, you may want to go and see them anyway, so why wouldn't they? Let's keep banging on anyway. What about gum diseases, Elizabeth Williams says? Yeah, good question. There's a lot of pathology around the teeth and gums. We know that, not just root canals. But, I read a paper somewhere where at the turn of the 20th century, dental disease and abscesses is one of the major killers. And by the end of the 20th century, periodontal disease, again, was a significant contributor to death by heart disease. It's like we'd turned a full circle almost. How would you do that, though? I mean, treating the face can be quite uncomfortable, but you have to get the settings right, presumably. How would you get treating?
Get the settings right. Like I mentioned, I work with several dentists, and even last week, I worked with 2 cases that the dentist brought to me, and we were able to turn them around within 20 minutes per case. The atypical facial pain, anything that has to do, with gum disease, of course, and vitamin C, something as nifty as vitamin C can turn gum disease around.
Well, also coenzyme Q10. Have you heard that one, John? That's a massively underprescribed substance for periodontal disease. Really important. I've been teaching that since the 80s.
Such an intricate part of the production of energy, and if that's missing, you just can't make new cells.
Yeah. Okay, pressing on. Sorry to have everybody rushing. Any practitioners in the Toronto area?
Yes, we have a lady now. Her name is Shalina Kasum. She's in the Toronto area. I'll be in Toronto on the 24th and 25th at the World Organization of Natural Medicine, where I am speaking, and Shalina will be there with me.
This man, sure, if it is a man, it's just signed El Mahabia. So that person, hope you're listening, just make contact and we'll connect you with John and this other lady, and you can meet him in Toronto. Would MCT help with a remineralization of osteoporotic vertebrae?
Oh my goodness, it goes all the way back to Robert Becker in his book, The Body Electric, orthopedic surgeon.
Yeah.
Did so much work on how the bone actually functions. And the bone is made up of collagen, hydrogen, and hepatide when you wash all the minerals away. And the collagen is the electrically conductive material that actually realigns when you pass a slight current through it. So if you really want to learn a lot about how the bone actually reorganizes itself with microcurrent, you want to read that book called The Body Electric, Robert Becker.
Right, and then otherwise get yourself a Sport Pro 3 and start. You can have a wonderful practice with osteoporotic women. It's a big problem for middle-aged ladies and onwards, isn't it? Chronic sinusitis, easy one. Do you want to come? Oh, what's this one? Cement-like mucus. Oh, yes. So will this help?
Yes.
Yeah, there's a. I'm
not sure what he means by cement-like mucus. I presume he means very tenacious, sticky, and stringy, but that's not cement.
Infection of the mucous membranes, sinusitis. One of the ways that we've done it is to get rid of that sinus pain. Is we use these little ear clips, and we put one in one nostril and the other in the other nostril, and we run current right through that whole nasal area, the whole nasal chamber.
But it doesn't hurt. Better say that quickly. Yeah. Doesn't hurt.
No, it
No,
doesn't
not
hurt
Yeah,
at
really.
yeah,
all.
no.
No,
You need to add that quickly, otherwise you turn them
you can
off.
do it we do it to babies.
Okay, another tinnitus question. So I'll just refer you to the other answer, Janet. Yes, very good. Well worthwhile the trouble and effort. My middle finger was amputated in January from a sash window falling down on it. There's 2 centimeters of the tip missing. Now got trigger finger in this finger. For the listeners, that means there's a little nodule in the tendon, so it goes kind of click when it passes under certain loops. It goes click or snap, and then you have to pull it, and it goes click or snap back to bent again. It's an odd thing, very annoying, but not itself exactly serious, is it? Anyway, the plastic surgeon, is now suggesting surgery to release it. What would your professional opinion be, you two?
Yeah, great success with trigger finger. I've done many, many, many over my time.
Oh, sorry, I should have turned it over to you quicker.
Even phantom pain as well.
All right, we've already done this one. Microcurrent to remineralize the jaw to circumvent bone graft. Yes, we already had that. Missed the first 10 minutes or so. Need some phone numbers to contact. Well, I don't just hand them out, Susan. If you email Scott-Mumby@gmail.com, that will go to Vivian. And if the people you want to talk to agree to their number being given out, we'll send it to you. Okay? And that would be true for everybody. George Drysdale. Oh, not a question. Much appreciated, though. Thank you all. Very interesting, very practical. Gout in the big toe. Stuart O'Connor asked that.
Yeah, gout is a tough one because the residue is almost like glass-like, with very sharpy little edges on it. And
Yeah.
when we try to move it too quickly, it hurts like heck because it's scraping.
So you just
Yeah,
go gently, but you treat it in the end. Yes.
yeah, go gently and we'll get it out of there.
Okay, Kelly's back. Bloated stomach. There's not quite a question. Bloated stomach, continual after eating, healthy or sugared foods. It's not quite a clear question, is it? I think I'll skip
No.
that one.
I would use directly on the abdomen.
Yeah. Okay.
We have
Uh,
protocols as well.
Helps with, again, I'm not sure these are not exactly questions. Helps with, oh yes, with the prevention of DVT due to immobility in the aged. Yes, because DVT is an inflammatory phenomenon again, isn't it? I mean, almost everything comes back to inflammation.
Of course.
Okay, help with sleep apnea. That's a good one. Can we do anything with sleep apnea? Says Judy O'Leary.
Yeah, what we use is we use a 783 harmonics program. Again, you can find that in the Advise Your Life or in the professional devices.
Right.
And yeah.
Sorry, I didn't mean to say stop, John. I've got finish. You have finished. Okay, press on. Is it possible to purchase if you're not a health professional? Yes, of course it is, and it's possible to attend the training seminar. You can become an extremely competent local layperson magician. No question. Lily again.
Yes, maybe just a little message that we formed an academy, the Academy of Applied Electrophysiology, in the Dallas area, and we've also received a clearance from the physiotherapists across America, where we're able to offer them continuing what they call CCUs, 16 CCUs, which is almost a year's supply. So physiotherapists are also very much involved in microcurrent.
Right. So
and ongoing training as well.
So that's what's it called? Professional training continuity units to show that they're staying current. Yes, I've not heard of CCUs, MCUs, and things. Yeah. Anyway, okay. Can you use the machine at the same time as having acupuncture? Yes, but why would you do that, Lily? I don't know. Any idea what she's thinking here?
No, not at all.
No.
I mean, you could do, but I don't see the benefit of it really.
Yeah, electroacupuncture was the idea. I think the Germans came out with it, where they would put a needle in and then they would pass current through the needle itself.
Yeah. Maybe perhaps means that. But why be invasive and stick in needles, which needs a certain amount of skill and always raises the hygiene issues. when these things work brilliantly through the skin. They connect directly with the nerves, and the messages get transmitted. Well, we're saying nerves, aren't we? But we all know collagen is a lot faster than a neurological system, the collagen network.
Collagen network.
Yeah, of course, you get some strange things here. What can I treat? Thanks, says Kelly Adams. Well, I think we covered a lot of things. Hypothyroid, any good?
Hyperthyroid. There are other things that are going on in hyperthyroid, whether it be liver issues, emotional issues. There are a lot of things going on that what we want to do is we want to find the causal factor behind all of this. Iodine is a big deal. We should be looking at.
It's a very, very complex problem, isn't it, really? Okay, Suzanne from Missouri. She's an RN. She says, can I use this device on clients?
I mean, your clients would prefer you did.
Yeah, that's true. I mean, we are not legal people that can legally advise you what you're supposed to do and not supposed to do. But we have RNs using them all over the world, don't we? So are the equivalent
all over the
in
world,
other countries.
and the community health centers now of Texas are using these, and
it is the RNs.
It is the RNs that are using it on their clients.
Right. Okay. Someone, Janet here. Janet says, Riapon. I had a look at the Avacia site for the Sport Pro 3, and it says it requires a prescription. Does this mean only professionals can buy it? No, we sell it, so you can buy it from the link I gave you. You can have one, and there's nobody can stop you. Why does the Avacia website say that, though, guys? Do you know?
Well, we're actually from Canada, so we don't need to be supplied with a prescription.
Yeah. I think that probably just says it all. I mean, I don't know what legal hassles poor guys trying to, sell medical healing in Texas are up against, to be honest.
Possibly not in New Zealand or in Australia or other countries in Malaysia. Right.
How long does it take to heal the liver? Wow. It's like how long's a piece of string? But let's say a lot quicker than any other method, yeah? Or coupled with other things, you need your alpha, your lipoic acid and NAC and those cool things and milk thistle and silymarin. You need all that good stuff, but add this in, yes?
Yes.
And it will speed it up.
The Russians used to say that it's almost funny because the Russians are known for drinking a lot of vodka, and I don't know if this is true or not, but I'm just going by rumor. And when they discovered that they could go in and see a skin art practitioner to reverse their liver damage, they were able to drink more.
Well, it's case gain, I suppose. One last one, because really I think I need to stop at the 2-hour mark. And as I said, for those of you who asked a question and you feel strongly about it, please email it. We'll make sure they get passed around and answered. But we're going to stop soon. So what about glaucoma? Let's make that the last one, shall we?
Glaucoma, what we're finding, and this is not me, these are eye doctors that are finding this, that when you do what they call this little wings, this alignment of the structure, it takes so much pressure off that glaucoma starts to normalize itself.
Right, okay, good answer. Okay, there are more questions. But we're just going to have to stop. I'm only just over the halfway mark. It'll be another hour of questions. First of all, you guys will help me by appearing again, won't you? We'll do another one because it's been hugely popular. So many people signed up for this. We're going to make the recording available, of course. But with all these follow-up questions, if we forward them to you, will you take care of all or most of them?
Oh, yeah, we will, definitely.
Okay, well, I can't say fairer than that then. All right, folks, well, thank you for those of you who stayed on. There's still nearly 200 people who stayed on right to the death, so that's good. And I'd like to thank our guests, John and Laurie Hache. They're great. They're always good fun to have, and of course we are, as you've gathered, personal friends anyway. If you want to meet with them, there are 1 or 2 chances, like in Texas. If you're in Asia, they can also go to the Kuala Lumpur meeting. But don't forget, we also have a Medicine Beyond seminar right here in Las Vegas, hosted by me. John and Laurie will be attending, and that's early November. In fact, the 14th and 15th of November in Las Vegas. But I know for some of you, especially out west, that would probably be the easiest way to get to meet these 2 masters of the game, because that's what they are. All right, thanks for coming, folks, and thanks again, John, Laurie. Thanks so much for your help. It's been wonderful.
Well, thank you for having us on. It's always a pleasure to work with you, Keith.
Yeah.
Take care, everyone.
All right. Thanks. God bless. Bye now. Bye bye.
Bye bye.